Hi, my name is Areej. I'm currently pursuing my PhD in computer science and informatics at Cardiff University under the supervision of Dr. Ali Abdelmadi. It's a pleasure to me today to be here to share some insights from my project, and I will present the paper titled An Obsessive-Compulsive Disorder Ontology with Reuse and Enrichment. Throughout the presentation, I will talk about what is OCD, and then I will talk about OCD ontology, start talking about the use cases of
Areej, sorry, I accidentally muted you. Could you repeat what you said?
Should I repeat from the beginning?
No, sorry.
Okay. Then I'm going to talk about the OCD ontology, starting from the use cases of the ontology, and then the methodology of ontology development. And then I'm going to talk about design pattern and reuse strategies. Sorry. So what is OCD? OCD is a mental health disorder that characterized by intrusive, distressing thoughts known as obsession and repetitive behavior known as compulsion. And the term obsession was first used in 19th century by French psychologist Barry Janet, and at that time, psychologists began to recognize the existence of obsessive thought and compulsive behavior as a distinct psychological phenomenon. And OCD has been characterized in the Diagnostic Statistical Manual of Mental Disorder as anxiety nurses in 1952. And the categorization had been updated in 1985 to be a type of anxiety disorder. And this category is still there in some of biomedical ontology. The categorization of OCD has been updated recently in 2030 in the 5th version of DSM to be a type of obsessive compulsive and related disorder. And this categorization indicates the unique characteristic of OCD and its related disorder. OCD share common features with other mental disorders, such as post-traumatic stress disorder and anxiety disorder. And researchers have made slight progress investigating OCD in different data types. And in the literature, I noticed that researchers that try to investigate OCD using textual data, the objectives there were mainly to try to distinguish OCD from other mental disorder, or to analyze the symptoms of OCD and its associations. And it's noteworthy that the researchers used restricted related terminologies of OCD. So I believe that well-designed ontology representation is an important ingredient in computer-aided OCD investigations. And due to time constraints, I cannot go through the literature review, but it's presented in the paper. So OCD existed in a number of biomedical ontologies, but there is some limitations. So, for example, here, semantic richness, structured richness. We're presenting here a figure taken from Mental Disease Ontology, showing that obsession defined in the ontology as a subclass of pathological mental process, which is subclass of pathological bodily process in the ontology of general medical science. Here, intrusive thoughts is defined in SNOMED CT in a hierarchical way, such as intrusive thought is subclass of binding of thought content, which is a type of disturbance in content of thought, and so on. And the definition here looks the semantic or the associations that contribute to the definitions of such concepts in the context of OCD. So the goal of the OCD ontology is to establish universally recognized and reusable vocabulary that organization, including healthcare research entity, can use to annotate and describe OCD consistently and in alignment with the standards, established standards, other ontologies, and to develop and over heterogeneous semantic services, such as decision support system and in the application of using machine learning. OCD ontology use cases. So the first use case is the creation of the knowledge graph. The second one is the annotation of OCD data. The third one is provide the application design and in particular here for diagnosis OCD. In this slide, I'm presenting the annotation process we employed to annotate or to analyze OCD forums data utilizing two ontologies, OCD ontology and SNOMED CT, and with the use of annotator tool provided by Bioportal. And the visual representation here depicts the outcome of the process by presenting the most frequent terms annotated through both ontologies. And it's noteworthy that the result in the left-hand side derived from OCD predominantly highlight terms that are highly relevant to OCD. For example, thoughts, anxiety, fear, compulsion, and so on. And in the contrast, we can see annotations result derived using SNOMED CT, representing broader scope, reflecting its general medical context. And this is because we are using domain ontology OCD, and we are not presenting a general concept as in the case with SNOMED CT. In this slide, we are diving into a concrete use case that exemplifies the practical application of the ontology. And this slide presents a use case taken from the reference, the book reference down DSM-5 in action. This use case represents a list of symptoms and with the resulting diagnosis as a primary problem, obsessive thoughts and compulsive behaviors. In this slide, we are showing how this use case is represented in the OCD ontology. And we can see court is the name of the person in the book. And court here is represented as an instance of a number of classes in OCD ontology. And these classes represent the list of symptoms for court. And court also has a relationship to other instances from other classes using an object property has associated emotion, has associated impairment. And reasoning over this representation, we can derive that court is an instance of class compulsion. Court is an instance as well to class obsessive thoughts, and these results are compatible to the diagnosis result obtained from the book. And here we are moving on to OCD ontology development. Drawing inspiration from well-established ontology development and methodology, namely extendable ontology development and a systematic approach for building ontology, we established three main stages. Each stage consists of number of steps. So the first stage is ontology development. And in this stage, there are two main steps. The first one is knowledge acquisition, and the second one is the conceptualization or the analysis. And in the first step, knowledge acquisition, we collected a knowledge relevant to OCD using formal resources such as DSM-5 assessment tools, such as Yale-Brown assessment tool, and we gathered competency questions concerning diagnosis question and its related pattern. And this is in line with the extendable development ontology that emphasizes the significance of sourcing domain knowledge from authoritative or formal resources. In the second phase, we are the conceptualization consists of three main steps. The first one is identification of concepts and relationship. The second one is provide natural language definition for concept. And this is in line with the extendable development methodology where formal definition are assigned to concepts to establish shared understanding of meaning of concepts. And the third one is to use description logic to define concepts of OCD. And here is we align with the systematic approach for building ontology that prioritizes the use of formal logic to represent domain knowledge rigorously and coherently. And here is an example representing the first stage of the methodology where we collect knowledge related to the concept obsession. Then we analyze the statements here, extracting the concepts. Then we provide a natural language definition for the concept obsession in the context of OCD. Then we provide description logic. And here is the visual representation of the class obsession. So obsession is equivalent to intrusive thoughts or intrusive image or intrusive urge and has associated thought appraisal. And there is an object property accompanied by where obsession is the domain for this relationship and compulsion is the range. I'm going to talk in the next slide about the ontology reuse and enrichment. Ontology evaluation, I'm going to come across this very quickly here. So the evaluation, we evaluated the ontology in three approaches. The first one is answering competency question using the Sparkle query. And then we use automatic tool. In this project, we are using OOPS, Pitfall Scanner. And the third one is to assess the correctness of the natural language definition assigned to each concept in the ontology, conducting a survey through domain experts. I will talk about the design pattern and reuse strategies that constitute a foundational aspect of our approach. So the reuse offer an efficient and structured way to build upon existing ontologies, ensuring consistency across different domains. And our reuse strategy encompasses three distinct approaches, each tailored to a specific scenario. So here, if a concept is well defined in the existing ontology and is aligned with the requirement of OCD ontology, then we reuse the concept by using the IRI, the International Resource Identifier. And here's an example. When a class activity is required in the OCD ontology, then we import class activity and its all associated axioms to the OCD ontology. And this is the same case in the symptoms. When we need symptoms class, we import the class symptoms and it's all associated axioms. And in this case particularly, activity represent a root class of activity of daily living ontology. So we are importing all the ontology in OCD. And it's also the same case with the class symptoms. So here is the root class of symptoms ontology. So we import the class symptoms and it's all associated axioms. The second strategy, when a concept is well defined in existing ontology, but we need to do some refinement for the concept. Then we created our own class, giving our own definitions to the class, and we keep a link to the predefined class using OWL equivalent to. So this here we can see when we want to define OCD, in OCD ontology, we want to define it as a subclass of obsessive-compulsive related disorder and as equivalent to obsession or compulsion. So we created our own class, giving our own definitions, and then we keep a link to a predefined class. And in this case, we are using class OCD in the disease ontology. The class OCD in the disease ontology represented mapped to mental disease ontology, and this ontology is mapped to two ontologies: mental functioning ontology and ontology for general medical science, which is mapped as well to the basic formal ontology. The third strategy is when we when a concept is existed in existing ontology, but the concept lack semantic and textual definitions, we like to keep a link to that concept using annotation property C also, and this is happen in the case of referring our concept to SNOMED CT. So here we refer OCD to OCD using C also annotation property to SNOMED CT. And we encountered a case where we cannot find any existing classes for a concept. So we need here to map these classes to the basic formal ontology using our subclass. And the mapping process take into account the characteristic of each class in the BFO and determine the most suitable parent class. So to guide or to help us on mapping process, we are using a tool developed recently, basic formal classifier aligning domain ontology to the BFO. And this tool employed question answering approach based on the branch of the basic formal ontology. And here is the 4 questions that guide us to represent assessment criteria as a subclass of quality. And these questions help us to understand the characteristic of quality class itself. So the quality here is the characteristic that can be attributed to any entity, and meantime does not request or required any further process to be existed as quality. So for example, mild control of thought can be attributed as an instance of class assessment criteria and can be attributed to a patient or a thought, and it doesn't require any further process to exist as a quality. Here's the representation of obsession in the ontology as equivalent to class obsession in the mental disease ontology, and giving definition as equivalent to intrusive thought, image, urge, and has associated appraisal, some thought appraisal. This is the number of classes represented in each reuse strategy. And here I can go through this quickly. Here we are showing the OCD design pattern allow us to represent another mental disorder, which is body dysmorphic disorder. So by following the development stage in the methodology, collecting the knowledge, and here we are just collecting from the statements relevant to the disorder from DSM-5 and doing the analysis, identifying the concepts and providing description logic, we can get to the representation of body dysmorphic as a subclass of obsessive-compulsive and related disorder, and equivalent to obsessional thoughts of appearance, which is type of obsession, and equivalent to compulsion. So here, the integration of WordNet into OCD ontology, we are using a design pattern, namely ontologies model, that allow us to incorporate a lexicon resource, which is WordNet. So using this pattern, we can represent the synonyms of OCD concepts, and it's not just synonyms. It allow us to represent all the associations of synonyms from WordNet, such as the sunset of the synonyms and the association of the sunset, such as the definitions and its relationships, such as hypernym to other sunset. Here's an example from GraphDB where obsession has two synonyms represented with brown circle from WordNet, and these synonyms have its associations from WordNet, such as sunset. It's also represented in Protege. Here I can show you obsession has two synonyms from WordNet using the sense object property provided by the model ontologies, and the synonyms linked to its sunset using is lexical sense of the object property provided in the model. And this sunset is represented here, has its definition and its hypernym, another sunset. This is the first pattern we are used in order to incorporate WordNet into OCD ontology. In the enrichment of OCD using contextual similarity, I just want to point out two points here. So the first one, we enriching OCD concepts using embedding model. And by embedding, I want to mention that we derived similarity from bioclinical BERT model, but we didn't train the model. We just derived the similarity term using cosine similarity. And oh, okay. So I'm gonna go very fast. Here we are derived similarity using cosine similarity, and then we go to represent incorporate the embedding, the information derived from the embedding. So we are using design pattern frag ontologies, which is an extent of the ontologies. Here is an example. So the obsession is represented using frag model. Obsession has similarity term in the green circle rumination. These two terms have embedding and are member of obsession rumination similarity, which is type of bag, and similarity, which allow us to represent the cosine similarity, the similarity score between the obsession and rumination from a pre-trained model. This is the first version of the ontology. And thank you.